Effective today, my administration is officially declaring the opioid crisis a national public health emergency under federal law.
In 2012, 259 million prescriptions were written for opioids, which is more than enough to give every American adult their own bottle of pills. Every day, over 90 Americans die of opioid overdose. We believe that the opioid crisis is the most important health issue of our time. We have produced this documentary to contribute to the public's awareness of this epidemic.
Well, I used opiates for about four or 5 years, probably. I've been off for at least 2 years, maybe longer, probably closer to 4 years by this point now.
Better part about 8-9 years maybe, and I've been clean for since around January. I think was the last time I did something like that.
Heard on a job site, under construction. I had stepped through a skylight on a warehouse and hurt my back pretty bad. Before that, I couldn't take them. Like if I went to the dentist and they prescribed them, I couldn't eat like a 7.5. I took a 7.5, I'd get sick. So I typically just didn't take them. Of course, I got in a situation where I had to take them and have a choice. So I was in a lot of pain. In order for me to go back to work, I felt like I had to keep taking them. By the time it was over, they were writing me 90 Lord's halves a month for like a couple of years. I really didn't need them that bad. I didn't need them that long for sure. I was definitely not in any pain anymore, and they were still writing them to me.
Started it, I think, when I was first introduced to opiates was I had my jaw broken when I was 21, and I had no insurance at the time. I went to St. Dominic's Hospital, and they said it was over the weekend, so they said that they didn't open the surgery ward over the weekend except for emergencies. So, and of course, I stressed to them, I figured that was an emergency, but to them it wasn't. So they actually put me on Dilaudid the whole time before I had surgery. So I was on Dilaudid and was receiving it whenever I needed it for about 3 days straight. And after that, they prescribed me to hydrocodone. I would use it recreationally every now and then if it was prescribed to me, I'd take it as needed, or if I wanted to. And then it became I'd say every other day thing, or every week. About 2 years ago, my dad passed, and I used it as an emotional crutch, and I became very addicted to it, and that's when my addiction heightened. Also, throughout those years, my mother has MS, and she was diagnosed with MS, and so she got quite a few hydrocodone every month. And so, it got to the point where if I needed it from her, I would get it from her. I would just complain and say it was my jaw, but 9 times out of 10, it was me just wanting to, have that feeling of numbness. And like I said, about 2 years ago, Dad died, and I took it very hard. I never dealt with it properly, so I drowned it out with all kinds of opiates, anything I could find. I got to the point where I was taking about 10 to 15 Vortep 10 or Percocet 10s a day. It never led to anything intravenously. I'm deathly afraid of needles. But I was at the end of my addiction. I was one step from that. After I realized, if I kept on going back to it, it wouldn't stop. Then I just figured put it down. Plus, being in this program that I'm in, I didn't want to keep on going back to jail. So But I'm very glad that I'm off of it. It's definitely a serious thing that a lot of people take lightly, and not many people know enough about. Um, you build up a tolerance so easy and so quick to opiates, that that's what makes it harder to get off of them and kick the habit. Emotionally, physically, you shut down. I mean, everything, it hurts. When I was in my heightened state of addiction, I tried to kick it just by weaning myself off. And I went from doing like 10 to 2 a day and got sick just by doing that. So, I mean, it's a real thing, and it's not fun.
I went to the doctor one day. He closed up office. It was completely gone. He had moved to Oxford or something. So I had to start getting him off the street. And, I got up where I was eating 10 of them at a time, something like that. So I wasn't real strong enough. I moved up to Oxycontin, Percocet and stuff. And somebody introduced me to Dilaudid. I was still getting my pain pills. I would actually sell them because it was cheaper for me to get the Dilaudid off the street. It would go further. Of course, with Dilaudid, it went to heroin before it was over. Couldn't stop. Sickness was so bad, and you don't have it. You're going to do everything you can to get it. I ended up homeless, living in shelter. Pretty much accepted that was just going to be my life. I was never going to get any better.
My biggest memory was when my ex-girlfriend and I would go to bed, and I would take my shirt off, and she would complain. She knew about it, and she would complain about seeing the ribs in my back and how my ribs looked like they were just eating my spine. And I was like, well, of course, when you're in that high state of high, you don't think of things like that. The thing you think of is, when am I going to do it again? Or am I okay right now? Am I high right now? Am I good? Do I have something else when I come off? You don't think of many things. I mean, really, for me, it was, I didn't want to feel anything. And that's what did it. It didn't make me feel anything, physically, emotionally, everything.
First time you run out and you get sick. Before I actually got dope sick the first time, I thought dope sick meant was like you did too much and you felt kind of sick the next day, like a hangover or something. I didn't know what it really was. And there's nothing that's going to make you not dope sick except for opiates. You can't go get cold medicine or something like that. It's not going to work. Nothing's going to work.
I still have jaw pain, but it's the type of thing that you have to learn to deal with. I have a plate in my jaw still, so just like anybody that has a plate in their leg or pins or anything like that in their knee, I mean, you feel it when the weather gets bad. So I mean, it reoccurs, but the pain itself from that, the real pain I got off within the 6 months, but it would come back for at least 2 years after that. And then, every now and then, like I said, even still, I still have it every now and then, but it's one of those things that's bearable. But when you're on that type of stuff, you don't want to bear anything like that. You want anything and everything to get away from any type of pain.
I smoke pot. And, I tried other things, but, I never had a drug problem at all. Opiates, it's awful. It's terrible. And now that I'm off of them and never had a desire to go back. Once I finally got it out of my system, and I had plenty of opportunities, even, before I was on drug court, there's just no way. There's no way I'll put myself to getting sick like that again. It's awful.
My aunt, which is my mother's sister, has dealt with I guess was a methamphetamine addiction for quite some time, most of my life. My real father was an alcoholic. My grandfather on my mother's side was an alcoholic, so I come from a line of alcoholics. But as far as any kind of hard drug, my aunt is the only one in my nearest blood that had that type of problem.
I walk in the office and I mean, you wouldn't even really examine me. You still hurt? Here you go. Had the dope, and that was it. In and out. He'd say something about it, but he didn't really push the issue or anything. It seemed like he was just really just wanting writing the pills to get me out of the office.
This is a general profile of those who are at risk. People with a history of substance abuse or mental health disorders are at an increased risk. In addition, young white males are most likely to abuse opioids. These are some warning signs to look out for. Individuals who are obtaining overlapping prescriptions from multiple providers and pharmacies, as well as individuals taking high daily dosages of prescription pain relievers.
Due to the current opioid epidemic, people are searching for options for those who are addicted. Currently, there are drug rehabilitation programs and drug court programs, such as the one that the men from the interviews were involved in. However, these programs can often be expensive or have limited available space. There is some research on biofeedback and cognitive behavioral therapy, but the evidence is limited. Few hospitals are implementing a program called ALTO, or Alternatives to Opiates program. With ALTO, patients are offered different methods for treating their pain. As the opioid crisis continues, people are still searching for the best answer.
President Trump has declared the opioid crisis a national public health emergency. People are using the word emergency because they don't know what to do. Everyone is still searching for a solution. The good news is we have a solution, and the solution is physical therapy. Choose PT is a campaign that encourages people to use physical therapy as a conservative method of pain management as opposed to opioid use. Low back pain, fibromyalgia, osteoarthritis of the hip and knee, all of these are diagnoses that opioids are prescribed to treat, but physical therapy can be an effective treatment for all of these diagnoses as well. Chronic pain can lead to an increased risk of addiction, so anytime that opioids are prescribed, non-opioid alternatives should also be incorporated into the treatment plan, such as physical therapy. So, choose PT.
Don't try it the first time because when you get to the point where you try heroin, you're going to like it and you're not going to do it just once. You're going to keep doing it. And you're going to get a habit. And the chances of you getting off are very slim. Everybody's dying. They're dropping like flies every day.
There are alternatives, and even if you absolutely need them, put them down once you know you're done with the pain. I mean, don't make any excuse for yourself. I would suggest that take only as needed and to find any kind of alternative to deny. And if you don't have to, don't do it.